Hello, friends. You may be measuring yourself with the scale and your body mass index, but believe it or not, body mass index is not the best metric out there. I'm going to go over the fat mass index and show you why it's more useful for you. Just keep in mind this is purely educational and informational. So many people have this suspicion that their scale is lying to them. Specifically, we know that BMI is something that does correlate with general health outcomes. Body mass index correlates with all kinds of things, including mortality, but it is very misleading for a number of reasons. So, in order to discover the truth about your relative amounts of fat or lean mass and your health status, you need to go deeper. The problem with BMI is well described by looking at the equation that determines BMI. BMI is very simple. It's just your weight divided by your height squared. And normally overweight is 25 to 30, and then obese is 30 and above. However, one thing is this cannot tell you the difference between muscle and fat because somebody who's like a football player can have a very high BMI, but all of their weight is actually disproportionately muscle. So you're getting an overly pessimistic reading from your scale. In addition, the BMI, as I mentioned, misses muscle mass, but also fat percentages. So having a really high percent body fat is not healthy. And this generally does correlate with BMI, but that's really what we want to know. In addition, the distribution, you could have fat around your viscera or your organs, and that's much more dangerous fat, whereas the fat under your skin or subcutaneous fat is fairly benign. So you want to know where is the fat distributed. So this picture helps make the point more starkly. You have two people with the same BMI, but very different body composition, different levels of muscle mass and distribution. Similarly, the person on the right is going to have a high disease risk for metabolic syndrome, diabetes, heart disease, stroke, cancers, and the person on the left will not. I think this makes sense to a lot of people. The reason it matters, however, is that you could be a normal weight and still be at risk. Now, this is probably one of the most important things because when you go to your doctor and they say, oh, you're fine, your BMI is 28, it's just a little bit above 25, or your BMI is 24, don't worry. There's something called sarcopenic obesity, which is when you have a normal BMI, but you have low muscle mass and everything looks okay, but your percent fat is actually very high. In addition, you could also be overweight but metabolically healthy. We need to look inside your body to know exactly how healthy you are. We need to know that biochemically, but also in terms of composition. If you don't get this right, you're going to misdiagnose people. You're going to miss health risks. For example, somebody who has this sarcopenic obesity or skinny fatness is going to have a bunch of health risks, for example, cardiovascular disease, that are going to be missed until they have a heart attack or diabetes. There's also a kind of stigma that's disconnected from reality because sometimes people feel like there's something wrong with their weight, but it's not connected to health. And we want to get rid of that stigma and focus on worrying about things that really matter. So the fat mass index is also a fairly simple equation. It's your total fat mass, not your total weight itself, only the fat mass, divided by your height squared in meters. And the problem is you need to figure out what is your fat mass. And to do that, it takes a little bit of work. So the fat mass index focuses, as I mentioned, on fat, which is the real factor. And the fat you can measure with a DEXA scan. And if you're interested in learning about that, check out another video I made on DEXA scans on this channel recently. You can also use a bioimpedance scale, like at your gym. Those are not as accurate as DEXA scan. They're off by many percentage points. So we don't really trust them, but they're better than nothing. And they give you a rough measure. So if we look at BMI versus fat mass index, the fat mass index is much better because it actually predicts disease risk better. It distinguishes lean versus fat. And it also works across ages and sexes because we know BMI predicts things like health and disease differently depending on how old you are and whether you're male or female. And those are a lot of the biasing factors behind BMI. What the research shows, let's dive into some of this in a little more of an academic manner. BMI is less good than fat mass index, specifically at detecting metabolic syndrome. And metabolic syndrome is one of these things we want to monitor because it's going to be associated with diabetes, heart disease, cancers, and other terrible things. Also, insulin resistance, which is a big part of metabolic syndrome. This is where your insulin sensitivity in your body is going down and you're on your way to getting diabetes. And of course, diabetes eventually will develop. So fat mass index is really helpful for knowing exactly where you are in terms of risk. And just to give you a concrete example, tell you about somebody I recently learned about who was in his 30s and had a just barely high BMI, but had a 37% body fat and a very high fat mass index and had already had high insulin even in his 30s. And we see this even in people in their teens and 20s. And had a very high risk for future cardiovascular disease when we looked under the hood biochemically as well. And as I mentioned, there's something called sarcopenic obesity, where you have high fat but low muscle. And this is linked to later in life fit, falls, frailty, and mortality. So we want to get ahead of this before it develops. So what is a healthy fat mass index? You need to know your number, just like you know your BMI, you need to know your FMI number. It's not just your weight. So as I mentioned, get a DEXA scan. Just Google DEXA scan in the city you live, and you'll find a local provider, hopefully. Fat mass index is classified in the following manner. So normal is 3 to 6 if you're a male, and 5 to 9 if you're female, because females have a higher baseline normal amount of fat mass throughout the lifespan. And then there's different categories of excess fat mass, obese class 1, obese class 2, and obese class 3, just like there is for body mass index. So for example, in BMI, obese class 1 will start at 30. In the same way, you want to know what your FMI is and try to get it under 6 if you're a guy and under 9 if you're a girl. All right. Why this matters for you is that it should empower you to get better data about your health. It should provide more clarity for your life to know exactly how you're doing. And if you're on a fitness program or you're taking a medication, you want to know how things are going. So you got to accurately measure things. Hopefully it's going to give you some control over your health, and hopefully it's going to help you get to where you want. So what you can actually do today, measure your fat mass, know your FMI, calculate this using this equation. It's very simple. And then please take control of your health. Do not let time pass and wait for a diagnosis of diabetes or your first heart attack before you take things under control. All right. Hope this has been helpful. Hopefully it empowers you to your health. Take care. Join my free newsletter if you're interested. Be well.